And welcome back to the Dino Bidala Show. Right now, very happy to welcome back United States Senator Bernie Sanders, representing the state of Vermont. He's chair of the Senate Budget Committee, but he's about to change committees. We'll have to talk about that. Senator Sanders, welcome back to the show.
Great to be with you, Dina, and happy holidays to all of your listeners.
Thank you, and same to you. So, Senator, you're chair of the Budget Committee, but now you're moving over in the new Senate to chair the Committee on Health, Education, Labor, and Pensions. Share a little bit about the mandate of this committee and what your focus is going to be.
Well, the mandate is very, very broad. Needless to say, you and I can speak for 12 hours on healthcare issues in America. Well, we cover most of that. We will cover educational issues from early childhood education, childcare, pre-K, all the way to graduate school, all the way to medical school education, and so forth and so on. So there is a huge jurisdictional issue in terms of education. And labor, well, we are looking at major corporations who are trying to make it impossible for workers to join unions. We will deal with that. How we grow the trade union movement in America, we will deal with that. We have within our jurisdiction the issue of prescription drugs and answering the question as to why the United States pays by far the highest prices in the world for prescription drugs, while the pharmaceutical industry year after year makes record-breaking profits. So that's some of the jurisdiction that we have.
And speaking of the unions, I mean, we've talked before about, we've seen a huge spike in the unionization going on. In fact, just the last few days, there was strikes at about 100 Starbucks stores. I know the House passed the PRO Act. We probably have talked about the PRO Act before. I've had members from the House on many times talking about the benefits of it. Is it simply Republicans won't support it in the Senate because they view unions as a threat politically, or do they view it as a threat to the bottom line of their donors?
Well, probably both, and we will see what happens. I mean, one of the changes that we're seeing in American politics is you have some Republicans who see the Republican Party now as the party of working families. And sadly enough, as you well know, in my view, because of the failures of the Democratic Party, you have more and more working class people voting Republican, and that breaks my heart. But in order to talk to those people, it may well be that some of the members of the Senate and House are actually going to have to do something for working families. And certainly, if you're talking about being pro-working class, you got to be pro-union, and you have to support something like the PRO Act. And in case listeners don't know what that is, it's simply ending the ability of employers and corporations to really make it very, very difficult for workers to join unions. All kinds of impediments in the way right now. Those have got to be stricken down. Workers have the constitutional right to form a union, but right now they're facing tremendous opposition, illegal opposition from large corporations like Starbucks, Amazon, etc.
You mentioned working class workers, that voters, I should say, they should be supporting us overwhelmingly in terms of policy. Yes. And I have numerous listeners who call and go, well, they're voting against their interests. I actually think it's because they have different interests than we think. We don't understand them fully. But is there anything more we can do? Because we are, objectively speaking, the party that stands up for the working class in this nation. We are not a game. We are 100%, and the other side's not. They're for the wealthy. Is there anything more we can do going forward?
Well, I think the answer is yes. Look, Dean, in my view, it's important, and I want to do this as chairman of the Health, Education, Labor Committee, to take a hard look at where we are as a nation for working people. So we can talk about some of the accomplishments that Biden, Democrats in the House and the Senate have achieved. That's important. But you know what? Take a deep breath and think about where we are as a nation. Right now, some 60% of our people are living paycheck to paycheck. That's a reality. In the richest country on earth, at the end of the week, after a week's work, people have nothing to put in the bank. How do we raise wages for American workers, especially those at the bottom? So to me, one of my priorities as chairman of this committee is to say, you know what? We're going to raise the minimum wage, hopefully to a living wage. There are people in this country that are working for $7.25 an hour, $8 an hour, $9 an hour. Nobody thinks you can get by working for those starvation wages. So I want to work to raise the minimum wage to a living wage, in addition to bringing about the labor law reform you've talked about in terms of PRO. we talk about the conditions of working families. The average, if you have a kid in childcare right now, you know what the cost you're paying? $15,000, $18,000 a year on average. In DC, where we are right now, I have staff paying $30,000 a year to have a baby in childcare. Who can afford that? Why do we maintain such a dysfunctional childcare system? You go to college, hundreds of thousands of bright young kids can't afford to go to college. Others are leaving school deeply in debt. Biden has made an attempt to cancel student debt for a whole lot of folks. We want to pick up on that and go further. We have a healthcare system. If you're an ordinary person, you're paying a lot of money for healthcare. How do we lower the cost of healthcare in this country? How do we expand healthcare, especially primary care? How do we get more doctors, nurses, mental health counselors, dentists that we need? So there's a lot to be done to improve life for working families.
And I'm chatting with Senator Bernie Sanders. So, Senator, we're obviously January 3rd, we lose the House. So what do you do about policy now? Is it passing? It's going to be very challenging. We understand that's the real world. We live in this real world. Is it about heightening awareness of these issues and saying, look, here's what we want to pass, and these guys are stopping it? Or do you have hope? Is there hope that you might get the Republican House to join on certain pieces of legislation?
Yeah, look, the Republicans have, I think, a 5-vote majority in the House. That's not a lot of votes. Not a lot of votes. And on issue after issue, there are Republicans who I think will be supportive of issues that will help working families. So I think what we have to do, Dean, is walk and chew bubblegum at the same time, in the sense that, number one, we have got to maintain a vision out there, even if that vision is not going to be supported by Republicans in the House, and by the way, a number of Democrats in the Senate. Mm-hmm. Is healthcare a human right or not? What do you think?
Yeah.
All right. I think you do. I do. Most Americans do. All right. Should you be one of the 60,000 Americans who die every single year because you don't get to a doctor on time because you're uninsured or underinsured? I don't think so. Should we pay twice as much as the Canadians or the Europeans do for healthcare, and yet we have 85 million uninsured or underinsured while the insurance companies make huge profits? Most people don't think so. So it's important, on one hand, to keep our eye on a vision, which says healthcare is a human right. I happen to believe the solution to it is a Medicare for all single payer program. Expanding Medicare, you go into the doctor, you don't have to take out your wallet, you don't have to take out your credit card. It is comprehensive, covers dental, covers vision, covers hearing. That's what a civilized, wealthy society should be doing. Am I going to get that passed? No. Won't get it past the House. I won't get it past the Senate. But it's important to keep that vision. Now, having said that, can we scale back a little bit in terms of healthcare and say, okay, you guys are not prepared to take on the insurance companies, the big money interest, I got that. But are you at least prepared to expand primary healthcare so that every American can get to a doctor when he or she needs to do that? And that means greatly expanding community health centers, making sure that we have doctors and dentists and nurses in rural areas and urban areas where we are now being underserved. So there are things that I think we might be able to do, and I want to do that, at the same time as I want to keep my eye on the big prize of where we should be going as a civilized society.
And polls show majority support, solid majority, healthcare for all. And what's remarkable, people think they have great healthcare. I had some claims this year. You think you have great health insurance until you have a claim. And then
that's exactly right.
My health insurance should come with a lawyer just to argue with them, because it's unreal. And the minute you have, and I am a lawyer by training, and I have to argue with them. I'm like, how,
my wife is a PhD. She has to argue with them and and you know what? Doctors have to argue with them, and nurses. That is why we spend far more on administrative bureaucracy than any other country on earth. Look, what the American people want us to do is invest in doctors, in nurses, in the provision of healthcare, not in bureaucrats all over the country who are telling you, well, Dean, I know you thought you were covered by this procedure. Turns out that you're not. And I'm being paid $100,000 a year to tell you why you're not covered when you thought you were covered. We are spending tens and tens of billions of dollars a year on that, on billing. All right? We want nurses. We want doctors. We don't want people to be billing us and driving us crazy if we're late on the bills. We have an enormously complicated, dysfunctional system. We need to simplify it. Healthcare is a human right, guarantee it for all. Let's have the doctors, the nurses, the dentists that we need.
I couldn't agree more. I'm sure that resonates with people listening as well. Anyone who's made claims. If you get to Medicare, it's different. I'm not there yet. At some point, God willing, I will be. But at the same time, look what happens. Spending money for medical care, tough getting the appetite for that, but spending $858 billion on a Pentagon budget sails through. You were one of 11 senators to oppose that. Share a little bit why you, I know why, but could you share a little why you opposed this?
It's an astronomical sum of money. Astronomical. Do we want a strong defense? Yes, we do. But to spend 800 and close to $900 billion on the military, $80 billion more than last year, $45 billion more than the president wanted, that is totally absurd. You know what? My guess is, I don't have the numbers in front of me. We could probably, for just that $45 billion that they went above the president's request, probably provide primary health care to every man, woman, and child in this country. What do you think about that?
Wow.
So those are the choices that you have to make. When it comes to the Pentagon, you got the military-industrial complex, enormously powerful, lobbying force. And I should tell people, the Pentagon is the only major government agency that has not yet successfully gone through an independent audit. So if you think there are not massive cost overruns, if you think there is not unbelievable waste and fraud within this $900 billion budget, you are sorely mistaken. But that's okay. That's just the Pentagon. But if you're on, if you're getting food stamps, we're going to investigate you because you got a new job and you're $10 above the income threshold. So that's what goes on here.
And I'm sure everyone listening is asking the same question. Why isn't there an independent audit of the Pentagon? How are they able to shield themselves from that?
Well, they come up with their reasons. I mean, and the truth is that Pentagon is an enormously complicated institution. But, I think at least there's a self-interest that does not want to allow the American people to get an understanding of the kind of duplication of services, the kind of massive amount of contractors that we hire who make far more money than the men and women who wear the uniform, the kind of profit margins that the military industrial complex makes, the kind of salaries that the CEOs of those industries make. The less we talk about that, the better they think we'll be.
Last two things. You've railed about billionaires and big money in politics. Now we have a unique thing, and it's about Twitter, but Twitter's not the real world. But Elon Musk is a billionaire, has bought it, and it seems like he wants to weaponize Twitter to be an apparatus of the right. And that does affect the real world. It could be part of their arsenal up there with Fox News and Breitbart and others. How concerned are you that Elon Musk, a billionaire, has bought this to be his toy? And it really seemed he was fighting today with Adam Schiff right before we came on, and Senator Warren yesterday, which is fine. That's freedom of speech, but I'm not against that. That's fine. But he is also advocating some right-wing things, misinformation,
and firing and apparently taking off of Twitter people who have been critical.
Journalists, yes,
right.
Definitely did that.
The answer is we should all be very concerned about it, and I am. But we should also be taking a hard look at billionaire control of media in general. All right. And one of the reasons I love and appreciate what you and other progressive media people are doing, it's important that in a media landscape which is dominated by large media conglomerates, that we have independent voices out there speaking about the needs of working families and about climate and about issues which the corporate world is not necessarily sympathetic to. But if you look at what's going on in media, I think you have 7 or 8 media conglomerates now that control about 90% of what the American people see, hear, and read. So you got, our friend Rupert Murdoch, who owns the whole Fox empire, is a multi-billionaire. Jeff Bezos from Amazon, second or third wealthiest person in the world, owns the Washington Post. Your major networks are owned by, it ends up by very, very wealthy people. And the problem there, Musk is doing his thing, which is outrageous. But generally speaking, when you have corporate control over the media, what ends up happening is a lot of important issues simply are not allowed to be discussed. For example, you got 3 people in America, Musk being one of them, who own more wealth than about half of American society. Do you think most Americans think that's what this country is supposed to be? I don't think so. You tell me. When's the last time you turned on ABC, Fox, CBS, NBC, and you saw that discussed?
You don't see that.
You don't see it. It's not allowed to be discussed. We have three major Wall Street firms, BlackRock, State Street, Vanguard, that are major stockholders in 95% of the S&P listed corporations. So in other words, you have a handful of Wall Street investment firms that have enormous power over the economy. Three Wall Street firms. You don't see that discussed. We are the only major country on earth that doesn't guarantee health care to all people. When's the last time you saw a real critique of American healthcare and contrast with what goes on in Canada, what goes on in Scandinavia? You ever see that? You don't see that. No. So those are issues that are basically not allowed to be discussed. So what Musk is doing concerns me. What role of Bezos plays concerns me. But it's a huge issue that we have got to address.
I agree. And last thing, I mean, are we increasingly becoming loosely an oligarchy that controlled by these big businesses that it's hard to break? I mean, look how we are outnumbered objectively when you look at Fox News, you look at all the right-wing publications, all the talk radio on the right. Now you got Elon Musk, part of the right-wing apparatus. Facebook, while kind of fair, is used by the right more than us. We are lucky we get our message out there. This is a remarkable time. And it feels like the control is smaller and smaller. And
well, Dean, I would kind of argue, and wrote a book, so I'm a little bit familiar with the issue coming out a couple of months, but I don't think we're moving to an oligarchy. I think you are an oligarchy. You know, just take a look at it. More income and wealth inequality in America today than we've had at least in 100 years. Billionaires are becoming richer. Working families are falling further behind. That's economic reality. In terms of corporate control, you're seeing more concentration of ownership. Industry after industry, whether it is media, whether it is financial services, whether it's healthcare, you can't pick up the paper and see, Wall Street gobbling up emergency rooms. Wall Street getting involved in childcare centers, Wall Street getting involved in various aspects of healthcare. So industry after industry, whether it is the food industry, housing, you're seeing more and more concentration ownership. That's oligarchy. And then you talk about the politics. My God, we went through an election where a handful of billionaires just contributed hundreds and hundreds of millions of dollars to elect candidates who represent their interests. So, I think taking a hard look at the power of the billionaire class and this movement toward oligarchy, I think there is nothing more important that we can do.
That's my focus for 2023. It's really going to focus on that a lot because it's before the presidential election year where we have to focus on that exclusively. But I think that people need to know more about this and not lose hope, but try to come up with plans.
That's right.
Fight back.
That's right. That's right. And Dean, let me thank you. I mean, when we do all of this, it is more important than ever that we have independent voices, people who are not afraid of taking on powerful corporate interests. And thank you for the work.
Thank you. Thank you, Senator. It's always great to chat with you. And I appreciate you coming on to elevate the conversation. And I wish more on our side understood the power of radio. We're reaching people in their cars, in their homes, when they're hanging out with their families. It's very personal radio. So thank you for years and decades acknowledging that. Have a great day. Happy New Year.
Okay, you too. And Happy New Year, everybody.